So now I'm going to talk about Clinton's healthcare plan, and this is kind of an expansion of Obamacare and possibly public option. So this represents a number of the people running in 2020 as well. So first off, I just want to say the Committee for a Responsible Federal Budget were kind of unfair in their comparisons. They allowed for, say, prescription drug savings for Clinton, but not for Sanders. They had increased medical costs over the years for Sanders, but not for Clinton. And they didn't really seem to increase the cost of Obamacare, certainly not much over 10 years, which Clinton did say she wanted to expand Obamacare. So long story short, they weren't consistent with their comparisons. But let's talk about the difference between Sanders and Clinton on healthcare. Now, Medicare for all, everybody is covered. So right now we're close to 30 million people uninsured, and that's estimated to cause about 30,000 deaths per year. Also, there's a lot of people currently underinsured. Just because you have health insurance does not mean you can afford health care. This is a very important point to make. Due to high deductibles and copays, a lot of people cannot afford to see the doctor even though they pay for health care, so they're paying their premiums and get nothing out of it. It's estimated that millions of adults do not take prescribed medication. This is just one example of what underinsured causes. And finally, a lot of people that do need to see the doctor for emergencies such as cancer patients, a lot of them go into debt due to their treatment, and they're much more likely to go bankrupt than somebody who doesn't have cancer, for example. So there are very large differences. Everybody acts as if expanding Obamacare leads to the same thing. However, expanding Obamacare is still through private insurance. So these things do not go away. Now, if you started adding caps and other restrictions through Obamacare to try to meet these goals, well, then you have another issue. The costs go up because you do not get the savings that you get from single payer. So if you try to meet the same goals that Medicare for all would meet, you'd be paying a whole lot more. So it doesn't make sense. Now, some people mention the public option. It seems Clinton warmed to that a little bit. However, even this is a little odd, because how does insurance work? Well, you need healthy and sick people. So the healthy pay a little more than they use, and the sick pay a little less. But you also need rich and poor, because there's a lot of people who can't afford health care. So you need the rich to pay a bit more. Now, with the public option, the rich people are probably going to stick with private insurance. So that means, and you probably will have a lot of the poor people gravitate towards the public option. But that means, again, it's not financed. You don't get the savings you would get in a single-payer system where everybody's in the same pool. You're also likely to get sicker people go to the public option, assuming the public option, is a bit nicer than private insurance, getting rid of caps, etc. Otherwise, there's really no point in having the public option. So, unless you make it something like, say, education, where the rich can still have their own private school, but they still have to pay for the public, then it's not going to work. In that case, it's not really public option, it's kind of public required. Again, you start gravitating more and more towards a single-payer system. Public option by itself solves nothing. So long story short, Clinton's healthcare plan, if it was to work at all, would be much, much more expensive than Medicare for all because it doesn't have the savings a single payer gives, or more realistically, it just wouldn't cover the same things Medicare for all does. You'd still have people uninsured, you'd still have a lot of people underinsured, and a lot of people would still be going bankrupt or into debt. So this is with or without public option. So a lot of you might say, okay, I can agree, Medicare for all makes sense. Financially, it's just the morally correct thing to do. However, it will never pass in the government. Now, well, this bothers me for two reasons. One, a lot of people who believe that were still very happy to jump on and support these false studies because it supported their view. Some confirmation bias, which is annoying on its own, but I guess more to the point. The second thing is, well, I think you're absolutely wrong. Now, you might recall when Obamacare was passed that Republicans did not support it. None of them did. So, a lot of people talk about, compromise and being a little more pragmatic, and they always say it in such a way as if they would get Republican support, which isn't true. Whether you're extending Obamacare or you're doing Medicare for all, in both cases you get the same amount of Republican support. So keep acting like it makes sense to be pragmatic for Republican support is just idiotic, to be blunt. It doesn't make any sense at all. But you know what? Let's make believe it did make sense, just hypothetically. This is not how compromise works. You do not start off in a compromised position. You compromise only when you have to. It's kind of like telling somebody how much you'll pay for an item and then trying to haggle over it. It doesn't make sense. If an Obamacare expansion or public option, if that's where you think things will end up, okay, fine. But that means you need to start more to the left of that. So that way you can get that point. If you already start in a compromised position, then the compromise makes you meet in the middle. That means your position moves even more. So again, you're not going to get Republican support, but even if you could, coming about this in some very moderate way is just dumb. So more realistically, what do we have to do? Well, we need to get moderate Democrats on board. Those are the only ones you really have a chance with. And this is kind of a self-fulfilling prophecy, or that whole whether you think you can or you think you can't, you're right. When you have somebody like Nancy Pelosi say, this will never happen because it will not get enough support, it's kind of amusing because she's the one that's causing it to not have support, right? In effect, she's basically saying, this will never happen because I will not let it happen. So the only way something like this is really going to move forward is if it seems there's a lot of support for it. If polls on Democrats start showing, 80, 85, 90% of Democrats support Medicare for all, this will force the people in power to slowly move in that direction. But so long as you're listening to the people in power tell you that it can't be done, and then you say, okay, it can't be done, and that's what you push for yourself, again, it's a self-fulfilling prophecy. Or just self-fulfilling. So, if it doesn't happen, you'll be right, but it will be your fault. The only way for this to move forward is to support it. This is similar to, say, when gay marriage happened. The more people that got out in front of it, the more people that helped bend that curve, the better. So the only way this will happen is if you support it. So, now I want to briefly talk about naivety. As I said before, I think healthcare was used as an example for how Sanders and his supporters were naive. So kind of like I said with just a second ago with the self-fulfilling stuff, the only way you're going to get stuff like this to happen is to push for it and to believe it can happen. So optimism is necessary. Calling it naivety is not really fair. So think, for example, if somebody's running for president and their chances are rather small. If somebody asks them, do you think you can win? They're going to say, yes, of course. I wouldn't run if I didn't think I could win. So you have to be optimistic. If somebody like that said, no, I don't think I can win, but I'm going to run anyway, then all their support would disappear. Their coverage would disappear. So having a certain level of optimism is absolutely required. This isn't being naive. This is, human nature. It's an absolute requirement. With that said, though, Sanders and his supporters were never as naive as Clinton and her supporters try to make out. Everyone made it sound like he was offering everybody a free pony, and his supporters were just eating it up and expecting to get one on day 2 of his presidency. That is not true. Having talked to every Sanders supporter just yesterday, I think I can speak on behalf of them. We all knew that it would take time. It might not have even happened first term. But the only way you're going to get this change to happen is to keep pushing for it and believing you can. So, Clinton and her supporters kind of made up straw men. They kind of painted Sanders and his supporters as extremely naive, which just was never true. It's pretty easy to show how much smarter than a straw man you are. But if you don't realize you're fighting with a straw man that you made, that kind of makes you a little bit of an idiot. And I found it a little odd that, during the primaries, everyone was saying how Sanders is just basically a kook. And so there's a big divide between Clinton and Sanders. But as soon as Clinton and her supporters needed the Sanders supporters, for the main election, it seemed they tried to find common ground. So they skewed us one way when it helped them, and then skewed us the other way when it helped them. And all the while, you thought you were the reasonable ones. Complacency is not intelligence. So now, very briefly, let me talk about some attacks on Medicare for All. So I've seen some articles recently where a number of CEOs of both insurance groups, as well as the one CEO of CVS, they started talking about Medicare for All and how they think it's bad. And this is just to show that there's going to be money used to try to kill Medicare for All. But I don't really want to talk about those things at this point. I want to talk about the subtler attacks. You may recall when Obamacare was pushed that there were a number of attacks on Obamacare. There were some things like the death panel, which were just obviously dumb, yet they made a difference. A lot of people thought there's a death panel. Obamacare was attacked with, saying that you'd lose your doctor. And true enough, some people did lose doctors, but not really because of Obamacare. It's just that's part of private insurance, as I'll discuss later. Another thing that people kept saying was, I don't like Obamacare because I don't want a bureaucrat between me and my doctor. See, an attack like that is very subtle. It doesn't really sound like an attack, but there's kind of an implication there. The implication being, right now, it's just you and your doctor, but with Obamacare, you'd have to do everything through some government agency. Of course, that's a load of shit. Right now, you have private insurance. So if anything, I'd rather have a bureaucrat than a private insurer between me and my doctor who's going to try to deny me coverage. But still, you get the point. By saying something like, I don't want a bureaucrat between me and my doctor, that type of statement isn't really a direct attack per se. It's not directly saying anything bad about Obamacare. It's subtler. It's kind of an implication. So you get attacks like this that slowly skew people's perception because they're very subtle. So let's talk about some examples with Medicare for All. Well, just last month, Sanders was doing a town hall with Fox News, so I'll use some examples from that talk. One thing that came up was higher taxes. And this came up a lot. It also came up in 2016. If everything is through single payer, and that's run by the government, then yes, your taxes will go up. It's a true statement. Well, generally speaking, I should say. However, it's a misleading statement. Let's say that you're an average person, you spend $10,000 per year on healthcare right now. Then, if somebody says your taxes are going to go up $10,000 for healthcare, that sounds horrible. However, if your taxes go up $10,000, but now you're also saving $10,000 because you're not doing private insurance, out of pocket, etc., then you're not paying any more than you were before. So saying higher taxes makes it sound like you're paying more. So what they don't include is that you're also saving money at the same time. And for most people, they would actually be saving money. So just saying higher taxes is misleading. It's similar to saying the government's going to be spending a lot more. That's true, but if the government is also getting more in through taxes, then that does not mean there's a deficit. So again, these type of statements where you only mention one side of them are misleading. And another thing that came up, and this one I thought Sanders discussed very well, I recommend watching the video, which I'll link. They were talking about people worried about losing their doctors if we go to Medicare for all. And Sanders made the point that with private insurance, you're more likely to lose your doctor. Whether you quit your job or are fired or change jobs, that might mean you change insurance, which means your doctor might not be covered anymore. Even if you stay with the same job, if they change insurance, it means you might lose your doctor. Even if you stay at the same job and have the same insurance, insurance companies sometimes drop doctors. So losing doctors is something that happens a lot due to private insurance. However, with a single-payer system, you're actually less likely to lose your doctor. Because whether you quit your job, change jobs, whatever, you have the same insurance, and it covers presumably everybody. So it's a very misleading thing. It's basically a lie to imply that you're more likely to lose your doctor. And you hear similar questions like, well, what about people who like their private insurance? And again, I don't really know what that means. If it means you like your doctor, again, you won't lose your doctor. Well, generally speaking. So these type of attacks kind of imply something that just aren't true. So you have to be very sensitive to this. And in 2016, I'm going to mention another example because this one was very subtle and misleading. In 2016, Hillary Clinton kept saying, we've made all this progress with Obamacare, we shouldn't start over. She kept saying Sanders wants to start from scratch. And actually during an NBC debate, Sanders actually called her out on that. He said by saying starting from scratch, you give the false impression that we're going to first dismantle Obamacare. And that is not true. In fact, Sanders not only supported Obamacare, he helped write some of it. So by saying something like that, you're effectively lying about Sanders and his intention. And, you know, how you phrase something is very important. So if you think it was an accident, well, you're being a bit naive. Clearly, Clinton and her campaign made a conscious decision to say that Sanders wants to start from scratch because she knew it would mislead people. It would make it sound worse than it actually was. So these are the type of attacks that you need to be careful of, the ones I've just mentioned, because they're very subtle. They kind of imply things that aren't true, but because they're subtle, you don't always see them as attacks, and so they kind of get under your skin and slowly skew how you see things. So be very wary of these types of things. Based on everything I've said so far, you should hopefully see that Medicare for All makes sense, and to support anything else just doesn't make sense. Now briefly I'll mention media bias. I won't go into too much detail because I actually might have a separate video solely on media bias. But whenever it came to healthcare, they were very condescending, just as many Clinton supporters were, whenever it came to Sanders and people supporting Medicare for All. So there are those subtle attitudes that kind of helped support people or help push them in the direction of thinking Medicare for All didn't make sense. But also they never dug into any of these studies. They just kept citing them, even though they were very easy to debunk. I also should mention that the US and New Zealand are the only two countries that allow direct-to-consumer advertising. In other countries, it is illegal for pharmaceutical companies to advertise their drugs directly to the consumer. And I say that for two reasons. One, it's just odd that we allow that. But most importantly, this means that the media get lots of money from pharmaceutical companies. And I'm not saying there's some big conspiracy or anything there, but it does mean they're going to be a little more hesitant to come out and attack pharmaceutical companies and really healthcare in general. So you need to be wary when you look at the news. I do want to mention one last thing. I recall when Obamacare passed and it started being implemented, you had a number of people come out, a number of Republicans that previously were against it, but then they ended up needing it. So they said, look, you know, I was against Obamacare. However, if it wasn't for Obamacare, I would have died. I was wrong. Now, part of me was glad that these people came out and said, look, I was wrong, because they were then trying to convince others to support Obamacare. But I was also a little upset because it's kind of messed up that you need to personally suffer in order to realize how good, Obamacare was for people. That your inability to empathize is frankly rather sad. It's kind of like with welfare or unemployment. You have people that are against it, but then when they lose their job or need support, then all of a sudden, oh, well, maybe it's not so bad, at least for me. And I feel the same thing's happening here with a lot of moderate Democrats. They haven't had cancer, so they haven't had to worry about insanely large bills. They haven't had any other type of issues that may have taken away insurance or caused large costs. So they don't really empathize as well to the people that are being hit very hard. And I find this a little sad. I don't see how you could not support Medicare for all, knowing just how much people suffer with the current healthcare system. So, anyhow, I think I'll leave it at that.